Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to show one more case here of Class 3 where we remove the 6-year molars. Looks like I misspelled class there. So anyway, we're going to take out the lower 6-year molars on this, and I've got 2 or 3 other cases I want to show you, proving that this can be done and people don't have to have this much surgery done. This is kind of like triple the upper and lower surgery, because moving these teeth back, we move the posterior teeth forward, and we can do the case, and it looks like a double jaw surgery case. So let's get on with this case, and we've got 2 or 3 more cases to show you here. So we let me get this going. Now, I don't think I have my little marker. Yeah, it's here. This is the young man that we did this on. We started this back when he was just quite young, deciding what to do. He had this mild Class 3, had some history of Class 3 in the family also, if I remember correctly, and he was a mouth breather, and he's in a bite. The lower arch is wider than the upper arch, and we have to spread this out as we've done in many of these Class 3 cases. The deciduous teeth are in, anterior deciduous teeth are in a Class 1 relation. Okay, you see the crossbite that he has on it's a unilateral deal. So people shift their jaw when their lower jaw gets bigger and it hits the cusp to cusp. A lot of times they shift and they can chew better on one side, down in that the grooves like it is. Okay, let's go on here on this side. It stayed on that side, so the lower jaw spread out, and then the person shifts over. There's a lot of them do that. They have only a unilateral crossbite. Okay, this is 1975, and this is the upper arch in 1975. He got some space between the teeth, and he needs it. Now when we got down to the finishing of the case, to get it interdigitated good, the lower teeth were kind of big for the upper teeth, so we took out one lower central, and it left a little excess opening there. We'll show that later on here. Now the cuspids are coming in. Looks like this is angled over to this side. We got a little tight spot right in here. Baby teeth coming in, and he's lost his baby teeth over here. We still have a baby tooth there and one here. Now we're going to expand the upper arch, to get it out, to get this in. Of course, the time we get this over here and this one here, we'll have to come in pretty close to get the cuspid into this gap. Now, down here, he had wisdom teeth. They were forming down there. I don't think it's showing this Panorex, but they are there. Okay, you can see the tip of one over here, and you see the wisdom tooth over here. And that's what we have to have before you can take this tooth out, you see. So we crowd it in there. We're going to expand that. And he had that crossbite, so we'll be pulling it to one side also. So here we've got the 6-year molars all banded and everything lined up. See where it's going to be. And then we'll decide that we can treat this case. It's out of Class 3. We can treat it by taking out these 6-year molars. So we first thought we might do it by removing this central, and we took it out, and then still we could get this back to Class 1. So we took the molars out, and then we'll keep the wisdom teeth. Okay, so here now we're still debating to finish it up that way. So we're going to take these teeth out, and we've already removed one of those centrals. And now this is age 14.8. Now at this time here is 15.1, and we've got the 6-year molars removed. Also, one lower anterior tooth is removed here, and this is moving up, and we've got this bend in here where it goes down, which keeps this coming straight, and it doesn't do it as good as the thing we've shown in other cases where we come in and we draw a little deal like that and make it go down there. This works okay, but not as good. All right. Let's see now. He's 15 and 1 month here. This is 1985. So you can keep up with the time on this if you just look at the dates on this. Now, here is 11/15 of 85, and we've got the teeth together now, and we got these roots parallel pretty well with everything in here. This is the wisdom tooth left. They come up in this spot right there. Same thing over here. We need to bring these roots forward, and that inclusion, this can help that, and this will come in. Now it's age 15 at this point. Now, here we've got these roots up better, you see, and the molars coming in. And this one is coming in too. The upper wisdom teeth, we leave them in there to kind of keep the upper teeth moving forward. He's 16 and 11 months. Now we've finished other than just taking this out and putting going to be a 3 to 3 lower retainer in. All right, here he's age 17.7, and we've finished him up. This wisdom tooth hadn't come in. We just stay with him. You can upright anything as long as the person's living. This is the 8th Panorex we took, but we'll upright that and get it to come in the right spot. So this is, he's age 17.10. And now, at age 27, my gosh, he jumped 10 years ahead. That wisdom tooth is back in. The upper wisdom tooth is set back here. All of these are in. We've only got 3 lower anterior teeth. And we got these to interdigitate better by doing that. Now there he is at 81. And here he is at 88, I believe it's here. There it is at 85. Now here the facial structure as he's matured. He's got a good facial height and no class 3 appearance here at all. Here's the straight-on facial. You can see that. Here he is with the both upper and lower braces on, holding them in place. And he has some fluoride staining of the teeth. And a little bit of that, but their teeth are very resistant to decay. So we've got upper and lower retainers, and that's kind of holding this together. But as he gets older now, this is going to separate a little bit. All right, that's 87. And the upper, the bite plate, keep it from deeply. That's the lower retainer we use. Now here he is in 97, and he's grown up now. And this is his bite. Now this separated slightly, and you have to feel that lower anterior tooth, but you don't see it much. but it needs to be, ought to fill that little gap with some composite. Now here are the teeth. He's not brushing with the best in the world, but this is 97. So this stuff holds. I mean, it lasts good. 97 again. And this is, just run through it one more time real easy. Here we took that out and finished him like that. And this is 97. That's 81 and 97. 81 and 97. That's 81, the way the mouth was. There it is, 97. 97, we have this gap here, I think, composite. We'll put a composite on both those laterals. We did this to help interdigitate the other teeth. That's 81. And there he was when we started. And I'm going to run back here and show you how, after we finished, he's quite a different looking guy. So anyway, this procedure works. And I'll stand on that. You can take the 6-year molars out and you back up the lower anterior as far as you need to. If you need to keep it where it is further, you put pins in it, and then you wear class 3 elastics off this and pull the upper jaw forward. If you're going to go very far with the upper jaw, you need a lip bumper, kind of like we used on the first case we showed here. And here they matched the teeth up. His lower teeth were a little bigger, and I took out one of them. I don't think I could have stripped them and got them underneath there to give him an overjet and overbite we wanted him to have. So anyway, that's the way we ended up. And here he is in 97. So thank you for watching. And I'm going to close up here. And this works, and I want people to check it out. If I'm not right, let me know. Don't tell me that I'm wrong without showing me why I'm wrong, how I'm wrong. And this works out, and these people, years after they're holding, I'm going to show you about 3 more cases, probably start that tomorrow or something, of this, taking out lower 6-year molars. When we first did that, people thought we were crazy, but it works. And you back these up, and it's like doing double jaw surgery to finish them. Thank you for watching, and I hope you'll tune back in and get these other cases where we did it, class 3 correction, by taking 6-year molars. I'm going to say goodbye now, and I hope you have a good weekend.